In this exchange, Senator Bill Cassidy presses a nominee on a critical public health question. What does shared decision-making really mean when it comes to childhood vaccines? At the center of the discussion is the Centers for Disease Control and Prevention vaccine schedule, and whether current medical practice is sufficient or in need of reform. This is not just a policy debate. It's a conversation about trust, transparency, and the balance between parental autonomy and public health goals.
I've listened, obviously, to everyone. I'll have a couple follow-ups. When you speak of shared decision-making as regards immunization, right now the doctor speaks with the mom or the dad as regards should the child be vaccinated. There's nothing like takes the parent out of the room and gives the child the shot. No, we're about to give and they discuss it and they give it. Are you speaking about something more than what is currently used?
I think, Senator Cassidy, I think that in our current landscape of our healthcare system, robust, thorough conversations about informed consent
So that should happen. So are you speaking of a formal consent form?
No, I'm speaking of generally that we need to unburden our doctors to make sure we're having conversations that address all parent concerns, that don't shame parents, and that honor the ability to have robust and nuanced conversations about medical decisions for our children.
But that happens. So you're advocating for something different, I think. My pediatricians tell me they routinely have these conversations. Are you advocating for something different than what my pediatricians say they routinely have?
If these pediatricians are doing that, I commend them, and I think that's fantastic. And I think we need to support doctors and our broken medical system.
But are you advocating for something different than the doctor saying, I think your child needs the hepatitis B vaccine? When the child passes through the birth canal, they are exposed to the same secretions that they would be through intercourse. By the way, when they're a teenager, they may have intercourse with someone who's a chronic carrier. Now is the perfect time, and it's safe. Now, would you ask for something more than that? Or I'm not quite clear because it seems as if status quo is not adequate, and that's what I'm trying to understand.
I support the CDC's recommendations on the vaccine schedule.
I get that, but I'm asking you, what I'm trying to get at, are you asking for a formal, informed consent as if somebody's going for bypass surgery or somebody's going for an appendectomy for an immunization?
I'm not necessarily advocating for that. I think that you and I both know from clinical practice that the constraints on doctors are monumental, and many American parents are frustrated by what they feel like is lack of transparency on the issue of vaccines. And I think doing what we can as medical leaders.
So what would that be?
It's encouraging a culture shift towards making sure that we're respecting parent questions, choices.
I don't see that culture lacking. And so that's where, when I speak to the pediatricians, they emphasize that they spend a lot of time discussing immunizations.
I spoke to a physician leader of a major medical organization last week who in his morning clinic saw 28 patients. I think you know exactly what I'm talking about, that the physicians are very overburdened.
In that case, I'm sure the nurse extender or the physician extender would be having the conversation. I mean, we both know that there's other ways to communicate. And so I'm not sure I know what you're advocating.
At this point, the conversation narrows to the hepatitis B vaccine, which the CDC currently recommends beginning at birth. Senator Cassidy's questioning highlights a key policy tension. Whether universal immunization at birth is primarily about early protection in high-risk scenarios or about long-term population-level prevention. The nominee emphasizes transparency, placebo-controlled trials, and trust-building measures, themes that reflect broader public debates about vaccine oversight and pharmaceutical accountability. It's worth noting that most childhood vaccines, including hepatitis B, were licensed based on rigorous clinical trials and ongoing post-marketing surveillance systems. But here's the larger question. When policymakers call for more transparency or culture shifts, are they identifying a measurable gap in the system or responding to public perception and mistrust? And how should leaders balance scientific consensus with parental concerns without undermining confidence in established immunization programs?
Which of course gives pause.
Broadly speaking, I am very supportive of what's been laid out by this administration in regard to vaccines, which is that We want to make sure that for all of our vaccines, we're pursuing gold standard placebo-controlled trials, that we are robustly and transparently studying vaccine injury, that we're making sure that conflicts of interest in any of the research around vaccines are addressed and understood, that post-licensing data is transparent and shared with the American people, and that we work towards a healthcare system where doctors have more time and ability and incentive to spend more time with patients for the sake of both the doctors and the patients. Those are all common sense things that I agree with. Now, the
Secretary has suggested that the fact that a pediatrician gets $5 more for vaccinating a child reflects a conflict of interest that would incentivize them to vaccinate a child, and the conflict of interest being pejorative, if you will. Would that kind of outcomes measurement with the aligned incentive to promote immunizations be considered something negative?
Senator Cassidy, I want to just back up and broadly just reassure you that this is not an issue that I intend to complicate or bring an agenda on vaccines. This has not been the core of my issue. As I said, I support the initiatives that the administration is putting forward to hopefully restore trust in public health through increased transparency and through placebo-controlled trials.
One more thing, I'm sorry, and you've made that point. You've presented very well, by the way. Let me just compliment you. It's clear that your concerns about metabolic disease are very important. And by the way, I agree with that totally. Do you agree with the need for universal hepatitis B immunization?
I think right now, any parent in America can walk into their pediatrician's office and get access to the hepatitis B vaccine for their child if they want it. And my understanding is that that all insurers have agreed to continue with cost sharing on that vaccine.
I accept that, but as universal hepatitis B immunization, irrespective of what age the vaccine would be given, is in your mind, is that an important goal?
It is accessible to every American family right now.
That's not what I'm asking. Is it an important goal?
I think it is important, an important vaccine. It's a life-saving vaccine. I also think that parents' autonomy and family autonomy.
No one's arguing that, because no one forces the child.
Well, that universal and parent autonomy, but broadly speaking, I believe that parents want to have a good faith conversation without shame with their doctors about vaccines, and that we need to move toward a medical culture where that's possible. And I genuinely believe that will help restore trust in public health.
One more time.
Right now, that's not
everything
the
you
current
say,
culture of medicine.
But the question is, because we want to support parents, the question is universal hepatitis B immunization an important goal?
I feel like we're going in a semantic loop here. Do you want to define for me exactly what you mean by that every child in America?
Yeah, should we be promoting to parents that for the long-term safety of your child, she or he should be vaccinated for hepatitis B at some time in their youth? At some time in their youth.
I think that's at some time in their youth. I think that's an important recommendation. Yes.
And so universal is that to say that you agree that universal hepatitis B immunization is a goal we should be shooting for?
I think there are many parents, and I think the administration question whether this vaccine is necessary for all children on the first day of life. And I think that certainly if we're talking more broadly about promoting universal vaccination in children at some point in childhood, I think that's a worthy goal.
Okay. And I'll just note that among some populations in Hawaii, up to 10% of the folks are chronically infected. And of course, we know that one of those may eventually marry someone who's not. So if they're not immunized and they marry someone who's chronically infected, then you're more likely to have acute infection in the person married to the person who's chronically infected.
Right.
And that's a very Hawaii specific, but it's of course can occur anywhere. Thank you very much for your testimony.
Thank you, Senator Cassidy.
This exchange ultimately hinges on definition and emphasis. Senator Cassidy seeks clarity. Is universal hepatitis B vaccination a public health goal? The nominee affirms the vaccine's importance but raises questions about timing and implementation. At stake is more than one immunization schedule. It's the broader issue of how public health institutions maintain credibility in a climate of skepticism. Universal vaccination policies have historically been justified by epidemiological risk and long-term disease prevention. Yet public trust depends not only on scientific evidence, but also on communication, transparency, and perceived fairness. So what do you think? Does calling for additional transparency strengthen vaccine confidence or risk casting doubt on established science? Share your perspective in the comments. If you found this breakdown helpful, be sure to like, share, and subscribe for more in-depth, fact-based analysis of the policies shaping public health and our democracy.